Welcome to the Red Chair series. This is a groundbreaking initiative brought to you by the American Heart Association Philadelphia and proudly sponsored by Mainline Health. This episode is really exciting because we're going to be talking about some of the latest advancements and technology when it comes to cardiovascular medicine. And we have a very distinguished guest here, Dr. Erin O'Malley Tysko. She is a clinical cardiologist and she helps women lead happy, healthier lives. Dr. Tysko has expertise in treating patients with coronary disease, heart failure, arrhythmia, lipid abnormalities, and valvular heart disease. You are busy.
I am busy.
You're very busy. So thank you for being here. You have a lot of expertise. What's exciting for you when we talk about new developments and new technology?
My job is constantly evolving, and I'm finding new ways that we can help patients and help women with cardiovascular disease. We're learning, and the more we learn, the more we can educate our patients and help them to lead healthy and productive lives.
Is there anything happening now, or maybe even on the horizon, that you find particularly exciting or promising when it comes to patient care?
The fact that we can now help patients who have valve disease in many different ways. It used to always be surgery, it was a big surgery, it was a week in the hospital, and now we have procedures for valve disease that you are out of the hospital in one day, which if you had told me when I started 20 years ago, I would have found that hard to believe.
When it comes to developing technology, emerging techniques, do you find that sometimes patients might be resistant to trying new things?
I think everyone has a comfort level, and it depends what you're used to, your previous experiences with physicians. This is very overwhelming. Finding out that you have heart disease and you need to consider doing some of these things, that's a big decision. So I think it's important when we talk to patients that we start introducing things, gauge comfort level, not make people feel compelled to engage with new technologies if they're not ready, but I think it's important that we let patients know all their options.
We always hear that prevention is key. What's your approach to preventative cardiology?
So one thing, and I know this has been very important for the Go Red initiative, is helping women understand their risk factors for heart disease on a personal level. Do you know your family history? Do you know what happened with other members of your family, males and females? I think being aware of risk factors that are unique to women related to pregnancy, high blood pressure with pregnancy, preeclampsia, toxemia, high blood sugar. These are all things that we need to make sure we're asking in the office so that we can provide appropriate risk assessment.
What advice would you give to anyone who's trying to maintain a heart-healthy lifestyle? I feel like sometimes we feel like information overload and you want to try to do everything, but what are some changes, even small ones, that I can make that can make a big difference?
The first thing I tell patients is it's challenging, so don't beat yourself up too much. I mean, we can't all have the perfect food every day, the perfect lifestyle, exercise. Yes. So I do think that trying to make small changes is important. And I tell patients, pick one thing. If you're a soda drinker, stop drinking soda. If you're ordering at lunch, try to pack your lunch. Maybe park a little further from your office and walk now that some of us are getting back to the office. So I think really taking a look at where you can do some things that are right for you, and then start small and build on that.
That's good advice, because I mean, you said it, look, we can't all be perfect all the time, but you can do those little things. What role does patient empowerment play in our cardiovascular health? What should I be empowered to do when I'm talking to my provider?
I think empowerment is frequently related to patients' comfort levels. Some older patients may be more comfortable with the traditional relationship of the doctor told me what to do, and they may not ask questions. So I encourage patients to think about what they want to get out of the visit, take notes on your own before you come in, bring those with you, have some things in your phone, because when we're in the office, there's a lot going through our mind. And then we leave and go, oh, I forgot to ask. But patients understanding about their disease, what they can expect, controlling their symptoms, and what we can provide for them. That's really the only way to have a successful treatment relationship.
Is there anything else you'd like to add or anything you feel like it's important for us to know?
The way we treated things previously is not what we're doing now. We have different ways to treat valve disease, atrial fibrillation, cholesterol problems. Maybe you were someone who couldn't take the traditional medications. Now we have injectable therapies, some of which you only need to get twice a year. So don't give up. There's a treatment niche for everybody. We can find something that will help you and make your life better.
Thank you, Dr. Erin O'Malley Tysko.
Thank you
so much for joining us.
Thank you for having me.
And stay tuned for the next episode of the Red Chair series.